Over the last couple of years, there have been progressively more restrictions on the types of plans and when folks with both Medicare and Medicaid, dual eligible beneficiaries, could get enrolled in a Medicare plan. First, as long as you had Medicare and Medicaid, you could go pretty much to any doctor that accepted Medicare that you wanted and didn't have to worry about it. Then folks got kind of shuffled into managed care plans that were mandatory when they had both Medi-Medi, and now they're putting guidelines or guardrails on which managed care plans a person is able to choose outside of the annual election period. So today, let's talk about the 5 biggest changes to dual eligible Medi-Medi Medicare plans in 2025. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is the best Medicare option for them this AEP, or really all year round, give us a call at the information down below and we can help them to make those tough Medicare choices. Previously, for folks who could qualify for Medicare and Medicaid, or Medi-Cal as it's called here in California, it was a godsend. It helped pay for some or almost all of the cost of medications. It put very light restrictions on when and which plans somebody could enroll into, and it didn't really push anybody into a confined sector of Medicare plans in the Medicare world. But in 2025, they sorta kinda are. So here are 5 ways they're gonna do that. One of the biggest changes to Medicare plans for Medi-Medi eligible Medicareans is the fact that they are taking it back old school and allowing folks to once again enroll in a Medicare health plan outside of the annual election period, that is AEP, but they can do it once every single month. In previous years, like 2024, it was only once per quarter with the exception of AEP. Now, it is back to every single month, meaning instead of 4 changes a year, someone would be eligible for 12 changes a year. This will allow folks who have changing health situations, or if their doctor leaves the networks or are no longer accepting that insurance that they are currently on, or need new prescriptions that are not on their current plan, it would allow them to change to a plan that better fits their need, but with one little slight sort of major caveat, but we'll get to that here in a second. So in an attempt to streamline the Medicare process, managing the costs to the state, and to narrow the options that Medi-Medi beneficiaries have access to throughout the year, along with the ability for Medi-Medi folks to change their plans monthly, comes the bumpers, kind of like bumper pool, in which plans they are going to be able to choose. Previously, before 2025, if somebody had Medi-Medi, they could enroll into a Medicare Advantage plan specifically designed for Medi-Medi folks that caters to extra healthcare needs and financial assistance that Medi-Medi individuals are eligible for, and to make the most out of benefits that they can get on a D-SNP plan, or a special needs plan, or dual eligibility plan. But they could also enroll into non-D-SNP plans that were available to anybody, whether they had Medicare or Medicaid assistance or not. If they chose a non-Medi-Medi plan, it ultimately meant that their Medicare benefits would be administered by a Medicare Advantage plan, and their Medicaid benefits would be run by oftentimes a different private company, and they did not coordinate and manage their benefits kind of in a very inefficient way because you have 2 separate entities, essentially creating a multi-insurance organization Tower of Babel, and they could do this basically every single quarter. So needless to say, it was a bit of a nightmare, but the Medi-Medi beneficiary had the option to choose a plan that fit them best, even if it caused more of a headache and more cost for the state. Now in 2025, although Medi-Medi beneficiaries will be able to change outside of the AEP every single month, they will now only have the ability to move into specific D-SNP plans or go back to original Medicare and choose a standalone PDP plan. The types of Medicare Advantage plans that they will be able to access outside of the annual election period now are only going to be those plans that are integrated Medicare plans, meaning that Medicare Advantage plans are also going to handle the Medicaid administration to various degrees. This also includes the so-called dual eligible lookalike MAPD plans that are now going to be off the table because they are actually plans that look like they are Medi-Medi plans for the Medi-Medi community, but they are actually not. For the integrated plans, there are 3 different levels of plans that are going to be eligible. Of these 3 plans, there are going to be the fully integrated, the high integrated, and the AIP, which are going to be just different levels of integration, but needless to say, standard MAPDs as well as the lookalike MAPD plans no longer going to be available. Ultimately, when we look at the pros and cons of this, it will mean that beneficiaries will get a higher level of service and coordination between their Medicaid and Medicare benefits, but at the expense of a variety of doctors, hospital networks that they'll have access to, as well as prescription drug plans. So I guess we'll have to see how that all goes. Another really big change, which I know is going to be a headache to say the least, but will go into effect regardless, is that it will still be possible for dual eligible beneficiaries to enroll into standard non-D-SNP plans. But it will only be able to be done during the annual election period, or AEP, which happens every year from October 15th through December 7th. And it will go into effect only starting January 1st. But of course, if they do this, the plans that they will have will not be fully integrated and could still cause coordination problems between their Medicaid benefits administrator and their Medicare plan. And now last up for today, and really important to understand, is that all this will only apply to the year-round special enrollment that is generated as a result of somebody having full both Medicare and Medicaid. So if you've watched the channel for any period of time, you will recall that there are still many other SEPs that allow someone to enroll into a Medicare Advantage plan, a D-SNP, or not throughout the year. Whether it is somebody moving in and out of their area, having specific illnesses, turning 65, losing Medicaid coverage, or losing a degree of Medicaid coverage, and the list really goes on. But there are other options to change if someone has a valid alternate SEP and has the desire to choose a plan that is not a D-SNP plan, even if they are Medi-Medi. All right, so that is the 5 important things to know about dual eligible Medicare plans in 2025. First is the special enrollment period for Medi-Medi individuals is going to allow them to make changes all year round, which is a big change. The second is the types of plans that they're going to be able to choose are going to be much more restricted than before. Third is that there's going to be a very big change, at least to varying degrees, in the level of integration that each plan a beneficiary can choose has. Fourth is that the standard MAPD plan selection will only be available during AEP. And fifth is that although special enrollment eligibility based off Medi-Medi is going to be more restrictive, there are other SEPs that will still allow folks to move into non-integrated Medicare Advantage plans, of course, if it makes sense. All right, so that's it for today. And if you have any questions about these programs, or really anything else related to Medicare options, or which one might be right for you, please don't forget to like and subscribe and to follow so you can stay updated when our newest Medicare information comes out. And also, you can give us a call at the information down below if you want to talk to us in person, or just check out our other great Medicare content on the socials, on YouTube, on Instagram, because we have new content coming out every single week. So that's it for today. And for Michael's Medicare, I, of course, am Michael, hoping you have a great rest of your day, and goodbye.